Are you, your child or adolescent experiencing any fear or anxiety about being separated from a loved one? Welcome back. My name is Alba Pietra. I am a child, adolescent, and adult psychotherapist. Today, we're going to focus on separation anxiety disorder. We've been looking into different types of anxiety disorders, and the separation anxiety disorder is another one. So, what is separation anxiety disorder? According to the DSM-5 or any other mental health psychiatric books, it's being described as a developmentally inappropriate and excessive fear and anxiety about being separated from someone that they're attached to. It could be a parent, a carer, it could be someone that they really are close to, it could be the important figure, the attached figure that they have, the figure that they have a close bond to. So I want to repeat that is developmentally inappropriate and excessive fear and anxiety about being separated from that person. In order for this to be considered as a diagnosis and as a disorder, the DSM-5, the psychiatrist might be looking for these symptoms. And it might be very common in children, in adolescents, but also adults can also suffer from this. So they might be looking for extreme distress of being separated from that person. Remember, that loved one. And when I say extreme distress, could be that they're crying excessively, they cling onto you excessively. They might not want to leave the house because they don't want to be living. They don't want to be separated from the person. So extreme distress. They might worry about losing that person or that or that close bond that they have, or that the person that they have the close bond with. They have excessive worry of losing that person. And also that there might be some possible harm to them, like someone might kill them or someone might attack them or something bad is going to happen to them, that they're going to lose that person. So the excessive distress, the excessive worry of losing the person, there is also excessive worry of something bad happening to them, like they're going to be sick or they're going to die or something like that. That's going to separate them from that person. So that's going to be excessive worry of something bad happening to them. They might refuse to go out. They might refuse to leave the house. They might refuse to go to school. And that's very common for children and adolescents because they don't want to be separated from that person. They don't want to leave that person. They might refuse to go to sleep. And again, it's based on the separation, that they don't want to be separated from the individual because they just want to be close. And they're so worried that something is going to happen if they go to sleep. And there's also another one that they might have constant nightmares. They might be constantly having nightmares about being separated from this person. Also, they might present constant complaints about pains, physical symptoms, headaches, stomach aches, pains anywhere in the body when that separation is going to happen. For instance, if you need to go to work and your child needs to stay in the nursery, they might complain, I have a headache, I have a stomach ache, or my knees hurt, or I'm going to vomit, anything. So there is a constant presentation of some kind of pain, some kind of physical symptom, as I said, that the child or the adolescent or the adult is presenting. For this to be considered as a disorder, this fear, this anxiety needs to be present for at least 4 weeks. And when I say this constant fear, I'm talking about every day, and that's present like constantly. You have to deal with it. They cannot be based on other mental health illnesses. And also it's very important to see that if this is affecting on your academic life, on your social life, on your everyday activities, that's another you need to be concerned about that and find support. I like to also take a moment to separate what's a normal separation anxiety. And we need to remember, if you're a parent or a carer for young children from the age of 8 months to 18 months, It's normal to have this anxiety of being separated from you, or from the parent, from the carer, from someone who looks after it and they're very attached to. It's normal. And we need to remember that young children has been with you in, if you're the mother in your womb or with the father, has been there, and you're the whole world to them. So being around the age of 8 months, 1 year, they start to experiencing independence, and they want to become independent. However, they don't just jump into being independent. They learn slowly, so they're gonna be slowly exploring that. So being separated when the child, a toddler, has to go to nursery, it's very normal for them to be crying, to be clinging onto you, to not want to be left in the nursery. And that is normal, that's healthy. That is a part of the development. However, it can become healthy when that anxiety and that fear persist after around 5, 6 years, 7 years. The child is still presenting these symptoms, these patterns of behavior where they still crying, they don't want to go to school. All of the just mentioned before, that is not normal, and that can become clinical. And also you need to, I wouldn't say clinical, that can become something that needs to be addressed by someone, and then the child needs that support. So anything above 7 years onwards, if they present some of the symptoms, it's not healthy, and you need to find the support. And yes, causes for this separation anxiety disorder could be because the child might experience some kind of separation when they were younger. They might lost someone. They might have some trauma around it. It could be lots of reasons. However, help is out there, and I have experienced children with this condition, and help is out there. They can heal from it. They can learn new ways to be independent. Do find support. Do reach professionals for that support. Contact your GP. Speak to the school about this, as it can become very stressful for the family, for the parent, and for the child, because they don't know what's going on. The adolescent might not know what's going on, and even you might not know what's going on. So it can become very stressful for the whole family, or for your loved ones, or for your partner, or for your mother, or for your husband, even for the person experiencing this. So do get support, do talk to someone. You can also reach me and ask me questions if you need to. You have my email, you have my phone number. Do contact me and find the support. I hope this helps, and all the best.